Someone suffering from delirium might not know where they are, what time it is, or what's happening to them. Unlike dementia, delirium is a temporary state of mental confusion that starts suddenly and is actually caused by a physical condition like an infection or even dehydration. After Millie was out of the hospital for 2 weeks from a hip replacement, I was scheduled to visit her 3 times per week. "Are you comfortable? Need another pillow?" Frank asked Millie. Millie is 75 years old and lives with her husband of 50 years, Frank. I think the day of the incident, she was looking at a photo album with Frank. "This is my favorite vacation to Niagara Falls," said Millie. "It was so cute how our little Ben wanted to carry that big umbrella up the path." "Oh, I'd forgotten that," Frank replied. "Oh, and Coney Island when Ben got lost. He was only 8 years old." "This must be Janet to help with your exercises," said Frank. "Hi, Frank. Hi, Millie. How's your hip this week?" I asked. "Oh, it's fine," said Millie. "Tell her what you told me yesterday when I helped you to the bathroom," Frank said. "Well, that doesn't have anything to do with my hip, Frank." She said there was a burning sensation. "I've been recording her fluid intake and when she uses the toilet. Now, let me get that paperwork. We might want to check you for a UTI since you had a catheter during surgery. But before that, Millie, let's check your vitals and get you up for a short walk." I approached Millie, and that's when she started acting strange. I could tell right away something wasn't right. She started tapping her hand hard on the book, kind of aggressively, and talking about her son Ben. I tried to take her vitals, but she pushed me away. "Where's Ben?" "Who's Ben?" I asked. "You know who Ben is. You took him." She wasn't making any sense, and she was really confused. That's when Frank came back. "She took Ben!" "Ben is fine," said Frank. "He's living in San Diego. Remember? We spoke to him on the telephone just yesterday, Millie. Janet is here for home health care to help with your hip. You just had surgery." I asked her a few questions to help figure out what was going on. "Millie, can you tell me your birth date? Who is the president?" But she couldn't answer them. "Don't you touch me!" "She never acted like this before," said Frank. "What's happening?" Frank was really worried. "I have an idea," I said to Frank, "but I want to call the hospital to make sure. Frank, you stay here and be sure Millie does not try to get up or hurt herself." "Hi, Dr. Flora. This is Janet. I'm with a patient who's acting unusual. She's very confused and aggressive. Could you lead me through the symptoms for patients with delirium?" "Is the onset of her confusion acute? Does it tend to come and go?" asked Dr. Flora. "It's definitely an acute onset. Her husband Frank says it's the first for such behavior." "Is she having difficulty focusing her attention? Is she easily distracted? Is her thinking disorganized?" "Yes." "How would you describe her level of consciousness?" asked Dr. Flora. "She's definitely hyper-alert. She's 2 weeks out from hip surgery and has the symptoms of a UTI, and based on Frank's notes, it looks like she's not hydrating enough." "This certainly suggests a diagnosis of delirium," said Dr. Flora. "It's great that you called, Janet. Let's treat the UTI and keep her hydrated. We can reassess in a day or 2. As a caregiver, it's important for you to stay calm, seek medical care, and encourage them to sleep and rest.